Okay, we're connected. You can begin.
Terrific. Okay. Good morning, everyone. I'm Laura Shaughnessy. I serve as the chair of the Professional Counselor Advisory Committee at the Kansas BSRB, Behavioral Sciences Regulatory Board. Today is Monday, August 4th, 2025. I ask that the members of the advisory committee, I ask them to respond to a roll call to signify their presence at this open meeting that's being conducted remotely by conference call and other electronic means. Jim Kilmartin.
Present.
Good morning.
Good morning.
Melissa Briggs. Do we see her on there?
I don't see Melissa. No.
Okay. Amanda Brown.
Present.
Good morning.
Morning.
Michael Countryman.
Here.
Good morning.
Morning.
Samantha Holloway.
Here.
Good morning. Jason Lee.
Here. Good morning.
Good morning. We said Masha Magzudi will not be here.
That's correct. Yep.
Okay, Vanessa Perez. No Vanessa right now.
She is present. I think maybe her audio is not responding, but Vanessa, we can see you. It's just we weren't able to hear you.
Amanda Patrick Gardner.
Here.
Good morning. And Amanda Wade.
Here. Good morning.
Good morning. I note the following BSRB staff are also present. We have David Fye.
Here.
Good morning. Okay, up next, David Fye will read a message concerning this meeting being held remotely.
Thank you, Laura. This is David Fye, Executive Director for the Kansas Behavioral Sciences Regulatory Board. Public comment allows the public to address the advisory committee about any concerns, but the Kansas Open Meeting Act, or KOMA, does not require the advisory committee to provide public comment or answer questions from individuals. However, individuals requesting to provide public comment could contact the executive director prior to the meeting by sending an email to david.fye@ks.gov. There will be no public comment at this meeting as no individuals requested time for public comment. Because we are conducting the public meeting remotely by conference call and other teleconference ability, I state for the record the following information. Public access to the meeting is being conducted by a medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the conference call and through the board's YouTube channel. While the meeting is conducted remotely, the requirements of the KOMA are not suspended. Therefore, we will be conducting this meeting pursuant to the KOMA. On June 23rd, 2025, we sent notice of the advisory committee meeting to all individuals who had requested notice of the advisory committee meeting. The notice was also posted on the board's website, ksbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and other media material have been posted on the board's website and are available for review. You may also request a copy of the agenda specifically by sending an email to david.fye@ks.gov with the subject line request for the agenda, and it will be sent to you. The notice contains information for the conference call and YouTube channel that allows public to attend the meeting free of charge. The notice also states that if we experience any technical issues during the meeting, you may call the board office at 785-296-3240 or send an email to bsrb@ks.gov. A recording of the meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using the link to the meeting on the agenda. And I did check the conference call line before we began. There's no one currently on the line, but if I hear someone beep in and introduce themselves, I will let you know.
Thank you, David. Okay, the meeting is now called to order and the advisory committee will begin discussion of the first item on the agenda, which is agenda approval. You all received an agenda from David Fye. And does anybody have any questions about it? If you do, please say so. And if not, I'll need a motion and a second to approve the agenda.
Move to approve.
Second.
Who is that? The second person?
Jason.
Jason. Thank you, Jason. Okay, all in favor, say aye. Aye.
Aye.
Opposed, same sign. Okay, the agenda is approved. This is a very exciting next item. We get to welcome our new advisory committee members. I'm very excited about that. I love new energy and new voices, and this is going to be great. So we'd like to have each of you, if you would please, just say a few things about yourselves. And I do think we should also, after we do that, ask the current advisory committee members to say a little bit too, so you know who you're dealing with. So if you would please I see Amanda Brown first on the list. Amanda, would you be willing to go first and say a little bit about yourself?
Sure, absolutely. So, yes, I'm Amanda Brown. I live in Hayes, Kansas. I am an assistant professor at Fort Hayes in the counseling department. And then I also have a small private practice in the community. I really love working with anxiety and neurodivergence in my private practice. And I teach mostly field experience courses at the college.
Terrific. Welcome. Jason Lee, you are next. Would you please say a little bit about yourself?
My name is Jason Lee. I'm a RCPC and also associate professor of counseling at Wichita State University. I teaching counseling ethics, internship, assessment, DSM theories. Yeah, thank you.
Thank you so much. Good morning. Welcome. And Amanda Petrick Gardner. And am I saying your name correctly, Amanda?
It's Petrick, but I rarely correct anyone.
Well, I thank you for saying so. I'll remember and correct me. You're welcome to correct me if I get it wrong. So Amanda Petrick Gardner, welcome. Good morning.
Thank you. So I'm an LCPC and supervisor here in Kansas, and I have a private practice here specializing in OCD and related disorders. I am the past president this year of KCA, and I recently returned to school. I'm getting my doctorate at the Counseling, Education, and Supervision program at K-State.
Terrific. Welcome.
Thank you.
Okay, let's let the current advisory committee members say a little bit about themselves. Who wants to go first?
I'll go. Can you hear me now? Okay.
Yeah, terrific. Good morning.
Good morning. I'm Vanessa Perez. I currently work for Mental Health America of South Central Kansas here in Wichita as their Director of Outpatient Behavioral Health Services. I've been with MHA for about 6 years and been on the advisory committee for 4, 3? I don't even know. It's been a while. It's nice to meet all of you.
Good morning. Thank you. Okay, who wants to go next?
I can go.
Great, Michael.
Good morning. My name is Michael Countryman. I'm the Chief Executive Officer for South Central Mental Health Counseling Center in Butler County. This is my second term on the advisory committee. So it goes by very quickly. Good group of individuals. Been with South Central for 20 years.
Wow.
So it's getting up there. But glad to have you all here. Thank you.
Thank you, Michael. Okay, who's next?
I'll go. My name's Amanda Wade. I'm an LPC in Pratt, Kansas. I work for Pratt Regional Medical Center in their behavioral health department, and I also adjunct instruct for Pratt Community College.
Great. Terrific. Good morning. Welcome. Okay, who's next? I see Samantha, Jim.
I can go.
Okay.
Yeah, I'm Samantha Holloway. I'm a teaching assistant professor at Kansas State University in their counselor education and supervision program. I teach primarily our school counseling graduate students, and I'm also their practicum and internship placement coordinator. I've been on this advisory committee since last summer.
Good morning. Thank you. Jim, I think you're up.
Okay, I wasn't sure. I was just going to lay back until I figured you'd remind me, Laura. Good morning, everyone. My name is Jim Kilmartin. I will probably still be the old member of this group as I am the other groups. I am a member of the board. I am the public member of the board appointed by the governor. I'm in my 3rd year of service to the board and my 3rd year on this committee. I retired from Stormont Vale Health after 40 years. Spent 25 years as a clinical director over multiple ancillary services, and the last 15 years as corporate risk manager and compliance officer.
Terrific. Thank you, dear, so much. And he travels all the time. So if you hear me giving him a hard time, there's always a different screensaver on his backdrop. He goes all over the world.
I will be sure to change it during this meeting so everyone gets the full flavor. How's that?
No pressure.
Okay, great.
I think we covered everyone. Did I miss anything? Looking at this list. I think we've got everybody. Okay, I'll go.
I
Okay,
did have one question. Is
yeah.
Amanda Petrick Gardner, is she any relation to Ed Petrick, physician in Topeka?
I don't think so. I didn't mention I'm in Topeka and I moved here and worked at Stormont and got that question a million times and I don't know, but it's not a
Oh,
common name, so who knows?
well, yeah, Ed's probably retired now, but he was great, a
Yeah.
great guy.
I've heard wonderful things. I hope I am.
Or maybe he hopes he's related to you. Okay, I'm Laura Shaughnessy. So I am in private practice in Kansas City. I have been, I graduated from UMKC ages ago and had a really, really good educational experience. And I love that we have so many educators on this advisory committee. I have mad respect for the work that you do. I always think about the adage, feed a man to fish and versus teach a man to fish. And you guys are doing amazing work out there in the community. Hello, Prague. Or no, Budapest.
There you go.
I have been in private practice for 25 years. I'm married. I have a bunch of kids and a bunch of corgis. And I love this committee. And I'm also vice chair of the board for the BSRB, which is really humbling. It's amazing how much work they do. And I hope David Fye is going to talk about himself, but he does 7, is it 7 of these a month, David, that you would do, or 6?
7 every other month.
7 every other month. And then the board meeting and all the things he's going to tell you that he does for the advisory committee and his executive director report, he does 7 times. So he has a national reputation for the hard work that he does. People seek him out and ask him to be on national things all the time because he's just a very smart man, a hard worker, and kind human being. So I love getting a chance to say nice things about him because it's easy. The advisory committee, we meet every other month, and you are out there in the field as you were all talking about what you do. You are the eyes and the ears of the students and the clients that we serve out in the community. So we take to heart, who we add to the advisory committee. We want it to be really representative of the areas that are served in Kansas and the voices that are served in Kansas. So we really value your input and we're so glad that you're here. And that's all I have to say. David Fye, are you going to say a little bit about yourself?
Sure, I'll go ahead and share a few things about myself. So I am the executive director for the BSRB, and we really appreciate all of you serving in this capacity. For those of you that it's your first meeting, welcome. We've communicated a little bit over email, and for some of you, we've known each other in some other forums, and so I'm really excited that you're willing to volunteer your time in this very important activity. As Laura mentioned, we have 7 advisory committees that assist the work of the board. And so I help to facilitate the work of the board. We have board meetings every other month for about 3 hours, but then to make sure that we can hear from the licensees and the professionals in each of the 7 professions regulated by the board, we have these subcommittees, which have board members on them, but we also have licensees and people in those professions. And in the advisory committee policy, which I'm sure you've read and are familiar with, it talks about wanting to have advisory committee members that do public practice and private practice and work in education. And so it adds to the voices that are in the room when the board is considering possible changes to the statutes and regulations, or looking to see how can we identify issues and maybe how the board can add value. And so I work with board members like Laura and Jim. But I think one thing that I'm really trying to put a bigger spotlight on is basically the 50 to 60 volunteer advisory committee members that we also work with. A lot of the decisions the board makes originate from these meetings of the advisory committee. And so really happy in my role to help facilitate this work and get to know all of you. A little bit of my background, I was a graduate from Washburn University, originally with a business degree in economics and management and a political science degree. And then I went to Washburn Law School, and I am an attorney. So I don't have an educational background in any of the 7 professions regulated by the board, but I did work for the Kansas Legislative Research Department for about 8 years. I was a principal fiscal analyst for most of that time and worked with health agency budgets and got to know a lot of information about the inner workings of the health system here in Kansas. And then got to know the agency because it was one of the agencies I worked with in terms of their budgetary process. And that's how I became familiar with the outgoing director just a little under 5 years ago. And when he announced that he was retiring, I applied for this position and the board hired me. And it's been a really, really great 5 years so far. Looking forward to continuing to help in this capacity with the board. As Laura mentioned, I do try to work with the board members, the advisory committee members, also attend national meetings to represent the state and relay the thoughts and the sentiments of the board members, and then pull information back to share at board meetings and advisory committee meetings. And Laura, you're too kind. I appreciate the compliments that you shared, but it's been a really great board. And I think as for those of you that are new, as you start to kind of see the way that things work together, some of the work that we did as an advisory committee last year went into the survey questions that went out to all licensees. And one of the topics on the agenda today is continuing to review the responses from professional counselor licensees in different ways. Laura and I were fortunate to be able to present information at a conference in June, and it was a great opportunity for them to hear from the perspective of an executive director and also from a board member. And I think, sharing that information and also sharing about the process we went through, we got a lot of positive feedback, and a lot of people were encouraged to go and maybe consider doing their own surveys and collecting data so we can all kind of continue to work together. So that's just a little bit about myself. If you ever have questions, if you need information about the BSRB, you're always welcome to reach out to me. You can reach out to Laura. I'll kind of transition from this introductory information about myself to the next topic on the agenda, which is just some basic guidelines for advisory committee members. If you'd like me to move that direction, Laura.
Terrific. Thank you.
Okay. Well, we will have a formal training for advisory committee members, and we have been doing this formal training about once a year. If you are not familiar with working on committees for state agencies, there's some different laws and requirements that you need to be mindful of, and we want to make sure that you understand what you're being asked to do in this capacity as advisory committee members, and then also some of the rules we have to play by, basically, too. One of those things I mentioned in the introductory information when we started is that there's things like the Kansas Open Meetings Act that are something we have to be mindful of. So when we have a meeting that involves a majority of members of the advisory committee, and there's interactive communication, so back and forth type discussion, and it involves the topics relevant to the work of the advisory committee, those things need to happen in public meetings. And so to facilitate the work of the board, what things that we do to make sure we're in compliance with the Kansas Open Meetings Act, or we call it also the COMA for the acronym, we put out notice about the meetings. And so those are posted on the BSRB website in advance. We also use a website called the Kansas Public Square. So we do ask advisory committee members to sort of help us with this. So we also send an email out to anyone who has officially requested notice of meetings. And so there's a few different ways that we put out notice for meetings. But we also designed our YouTube channel specifically to allow greater access to the meetings for members of the public. And so while we're doing these meetings remotely, we want to make sure that members of the public can go to our YouTube channel and can view things live and can go back and watch the meetings afterwards. And so we're really trying to put that information out there. And then if there's any handouts that you would receive that you would go through during the process of a meeting, we post those on the website so individuals from the public can review that information and follow along. And I'm happy to say our YouTube channel has been very popular, and it's been a great resource that we've used to connect to more licensees and students and other people. And so we generally have about 40 people on average watch the advisory committee members or the meeting from one meeting to the next. And that's been a really good way to have more outreach. Another thing is the Kansas Open Records Act, the KORA. And so the Kansas Open Records Act is something to be mindful of too in your communications about the advisory committee. I just want you to be mindful, if you're not familiar with this, that those items can be considered records. And so if someone were to do a records request for certain information, that can apply to board members of BSRB staff, or it could apply to advisory committee members too. And so you're all professionals. You really don't need a reminder about this specifically, but I always try to, stress it every time, is that if you're having communications like emails or even texts or things like that, just be mindful to keep things professional in the dialogue that you have, because any of those could be considered a record and pulled into a request. And so, in general, we'll walk through a little bit more detail of your responsibilities as advisory committee members. One thing that we will do is we will take items from the board meetings, and then we will defer some of those to the advisory committees, so you can weigh in on those subjects from the perspective of, in this case, professional counselors. So when we were looking at unprofessional conduct regulations and looking at the review of that a little while back, we had each of the advisory committees weigh in on changes to their professional conduct or unprofessional conduct regulations. When we were talking about building survey questions and reviewing survey questions, that's something that each of the advisory committees is working on as well. Some other topics that we're working on as advisory committees are the possible regulation of artificial intelligence and things like that. So one of the things that the advisory committees are really helpful at is reviewing information from the perspective of your profession and then coming up with any recommendations. And sometimes it's appropriate to say, we reviewed this, we don't have any official recommendations, and that's perfectly fine. The advisory committee's authority is basically to make recommendations to the board. In terms of a vote to do a specific action, most of that still remains with the board. So if you're curious about sort of the authority of the advisory committee, it's really to work in service of the board. And so some people, if they're used to being parts of advocacy groups, may have questions about, can the advisory committee advocate for something? That's really not the function of this advisory committee. This is really more of a discussion forum, a forum for education, and then also to refer recommendations to the board for the board to take official action. Now, that doesn't mean that in your work outside of this committee, you can't serve on different groups that might have that purpose, and that's perfectly fine. It's just for the purpose of this forum, just make sure that when you're in these meetings, you're wearing your advisory committee member hat and kind of following the guidance that we provide for that purpose. So it is expected that advisory committee members will attend most advisory committee meetings. If you're unable to attend a meeting, go ahead and send me an email, and it's okay to include Laura on that email as well, so that we make a little note so that we're aware why you may have missed a meeting. If we have too many members miss a meeting, that could potentially involve things like quorum. And if there's a lack of quorum, we may not be able to take action that meeting. We can still meet for informational purposes, but it can delay things if we can't take official action. Other than that, there's information that talks about advisory committee members kind of trying to meet the same expectations of board members. So acting, with virtue. If there's information that you should receive that would be confidential in nature, making sure that's confidential during the time that you're advisory committee, and then also that follows that. You probably won't be asked to serve in executive session. You don't play a role really in the licensing decisions of applicants in this forum. Also, you're not part of the board's complaint review committee, so you're not going to be asked to review disciplinary complaints. What you're really focused on really are the policies and procedures of the BSRB and the statutes and regulations. So if you can offer guidance on improvements to statutes, regulations, policies, that can be forwarded to the board, and then it's members of the board who really serve as the members who deal with some of that other work. But your work is really important. And like I said, I've been really trying to put more of a spotlight on the work of the advisory committees, because I think this is the way that I describe it to some people as we have 7 boards in one, in a sense, because there are some other states that might have separate boards, but I think we really gain a lot of value and efficiencies in having one board that's made up of representatives of the 7 professions and also members of the public. Partially by sharing licensing staff, by sharing investigators who are familiar with the DSM-5 and some of the work in the mental health professions. But we also have licensees that are sometimes holding multiple licenses. So there's some natural crossover there too. But I do think it's still important that we hear from the representatives of the individual profession. So like I said, we are working on a training that will be about an hour-long training. Traditionally, we have had that as part of an advisory committee meeting, usually in the fall, pretty close to after new members start. But we have a little bit more work to do as an advisory committee this fall. And so I may reach out with a different format for that. I'm still kind of working on that, but I was thinking about maybe scheduling 3 meetings at different times and then asking advisory committee members to sign up for one of those 3 meetings. So that way we can reserve more of the time in the advisory committee meetings to the work of the advisory committee. So I'm trying something different this year. In the past, we've kind of gone through the same training 7 different times for the 7 different groups of advisory committee members. And that is still really important and helpful, but I'm trying to make sure that we can accomplish the same goal while being a little bit more efficient with the time. So I'll have more details on that, but that's just something I'm working right now. So, but we're not going to do the long training today, but I thought I would open it up if any of the new members have any questions, or if any of the members who've been serving on the advisory committee want to share any comments about some of the rules, if there was something that confused them at first, and they thought that might be helpful for new members to be mindful of. So if you do have questions, I'll go ahead and open it up now and let me know if you have questions on anything.
Anybody have any questions? One thing I will say as a board member is how I began my work a little frustrated with the limitations, and now I'm grateful for them. I cannot tell you how many times I've asked David Five, make sure I stay in my lane. You know, we're paying attention to statutes, to regs. We are protecting the public, and we are making sure that our licensees, our students have what they need. And that really became once I understood that framing, it was really easy for me to then think about the advisory committee and understand that, you know, you are, again, the eyes and the ears out in the community about what students and, you know, employers, clients need. So it was something that I had to learn. You know, I'm a mom, I run my own practice, so I'm kind of used to doing what I want. And so it was really nice to kind of finally, you know, really gain an understanding of, you know, the limitations are actually good. And so you won't really feel a lot of that because statutes and regs are something that the board deals with and the advisory committee doesn't really deal with directly. But that's always in the back of my head whenever I'm thinking about the discussions that we have. So I just wanted to say that out loud. And does anybody have any questions about the work we do? This is a great time to ask. Okay, well, when you do have questions, as David said, don't hesitate to reach out to him, to me. We will always answer anything that we can, and you know, questions will definitely come up, and don't be afraid to ask about them in our advisory committee meetings as well, because if you're asking a question, someone else might be thinking about it, or it might illuminate another question that needs to be answered. So we're very open and helpful, and we will always answer anything that you have.
And Laura, I would also say for those that are new, if you're looking at a next step, it's always good to look back on past advisory committee meetings to kind of see the information posted on the website in terms of the agendas and the topics. We also encourage members of the advisory committee to read through the statutes and the regulations for your profession. And so if you are not familiar with that, on the BSRB website, we do link to the statutes. There's a section that has board statutes, but then there's also a section of statutes for each of the 7 professions. And they are separated out by different categories. So there's one on definitions, one on educational requirements for licensure, different things like that. So a statute is a good place to start as you're becoming familiar with some of the things that we're working under. The statute is basically law. So when they pass a bill, that does become the statute. And then within the statutory framework, we are able to promulgate, is the word that we use, regulations that have a little bit more specificity and kind of flesh out the details to help licensees and applicants understand what's expected or required of them when they apply for licensure, when they're trying to make sure they meet the professional conduct expectations and things like that too. So the statutes are on the website. They're linked from the Revisor of Statutes website. The regulations are also on the website, and they're linked to the Secretary of State who publishes those administrative regulations. So if you go to our website, just get a little bit more familiar with the BSRB website and some of the resources there. And if you do have questions as you're going through things, please reach out and let me know. We're in the process of updating some of that information. So if something seems a little strange to you, just let us know. It's possible that could be something in the process of being updated, or it's something that we need to work on. And so we kind of rely on you to really help us out. As Laura said, you guys are the eyes and ears, and we appreciate what you bring into these meetings. And then if you can help us, we're always trying to get better at what we do as well.
I'll also add, David has really spent a lot of time improving our website and just making it more comprehensive, and it just gets better and better. So it's, you'll find more and more things there that are good resources for you. And we actually have a lot more for professional counselors that we're going to have to add because of the compact. So there's just going to be more and more out there to be seen. So yeah, take a look at our website. It's really gotten good. David, is there anything else you want to add about all that?
No, I think that's pretty good. If nobody has any questions, maybe people will have questions later, and they can always reach out to myself or Laura after the meeting if you do have questions after the meeting.
Terrific. Then we'll move on to approval of minutes. We have 2 months of minutes, and actually that was good timing because you could really kind of go back and look at those and see what we were up to for the last couple of months. So, David, I assume I need 2 separate approvals for each of those minutes?
You could actually combine those in one vote if you want to,
Okay.
unless people have, unless they would like to split them, or if there's any requested edits or updates to them.
Okay, so if we have edits, we'll split them up, but if not, then we'll ask for a motion to approve both the meeting minutes from April 1st and June 5th of this year. Do we have any questions or changes? And if not, do we need a motion?
I move to approve both sets.
Thank you, Jim. A second?
I second.
Thank you, Vanessa. Okay, we have a motion and a second. All in favor, say aye.
Aye.
See a lot
Aye.
of hands. And any opposed, same sign. Okay, I see no opposing. So the minutes from April 1st and June 5th are approved. Okay, Executive Director's Report. So David Fye will give he does a comprehensive report of advisory committee and board work. So this is a great opportunity to hear a little bit more about what goes on. David, go ahead. Thank you.
Thank you, Laura. And yes, as Laura said, every advisory committee meeting, I try to give the advisory committee members some updates in terms of BSRB operations, any kind of legislative updates that might be information that would be helpful for them, and then summary information from the most recent board meeting. So we'll start with some operations updates. I did want to mention, as Laura talked about, we've had some changes to the BSRB website in the last year. We have moved to a new website under Granicus, and it does look a little bit different if you're familiar with the previous website. And recently, there was an article that came out from the Association of State and Provincial Psychology Boards, ASPPB, which included our website along with about 9 others, and an article called Setting the Standard, 10 ASPPB jurisdictions leading the way in user-friendly psychology licensure websites. So I realize it's a different profession, but as a composite board, we have one website and we have sections that help out different professions. And so it was nice for the website to be recognized. One of the things that they were looking and praising the agency with was the reader-friendly features and the structured navigation of the website. And then there was another article section that talked about licensing tools and self-service features that they were complimenting the board on. So did want to highlight that. It was a nice honor to be recognized with some other states and jurisdictions. And so we are doing that in a mindful way. We are trying to make sure that we post good information, but also that people can find it in a helpful way. So happy to get that praise and report it. A lot of our staff members have done a lot of really good work on the website as well. So I want to compliment them and praise them for that as well. In terms of other operations updates, last meeting, we talked a little bit about CE Broker. And if you're not familiar with CE Broker, basically that is a company that offers a service to licensees at states licensing boards in multiple states as a way for them to upload documentation that they have completed their continuing education hours. And it's a free service. They offer to licensing boards, and a free service they offer to licensees as well. And you just have to activate an account. The board did reach an agreement with CE Broker late last year, and then we worked with members of their staff to build a site of their website for each of the 7 professions. And so all of our licensees now can activate an account and upload documentation. The purpose of this is we audit 10% of our licensees when they renew their license, and that is for compliance with the continuing education requirements for the profession. If someone is utilizing one of the CE Broker accounts, they can upload all of their information to show they've completed all their hours. So if they're audited, we can go into the system, review them, and then if they are all suitable, that person's audit is finished very quickly. There's even a way in the system that people can assign them in certain categories, like 3 hours of ethics or a certain number of hours in diagnosis and treatment. And so that is something we are encouraging more and more people to use. We collected some feedback from advisory committee members last meeting, and I had a meeting with the e-broker representatives to try to improve our processes with them. I did bring back some data. In terms of meeting with them, they basically said that we currently have about 16,500 permanent licensees with the BSRB. Based on the CE broker information, there's about 1,757 licensees currently engaging with the platform. So it's about an 11% adoption rate. The way that CE broker actually functions as a company is they have an optional paid service that people can opt into for some additional features. One of the things is they can connect people to CE opportunities and things like that. But we made sure in our agreement, no one was required to pay the fee for the extra services. If you did do that, you would have to pay the fee, but we made sure that everybody had access to the basic free account. And so all of our licensees have that option, but if they want to pay to do the higher service, they can. But combined between the free and the paid, it's about 11% adoption rate. Since we have gone live with all 7 professions, I think the last group that went live was in January of this year. We asked them how many issues that they have received from people. They said over that time, they have 26 total tickets that were submitted from licensees. Actually, 19 were from licensees, 7 were from non-licensees. We've also allowed our pre-approved providers for social work, continuing education to sign up through their system. So a few of those tickets were from some of their providers, but about 19 were from licensees. So I think that's pretty good over the course of 6-7 months. Only about 26 tickets with issues. We are working to improve how we're using CE broker. When we originally built this agreement, we wanted to have it live linked to the renewal of licenses, so that the way it would work is when someone goes to renew their license electronically, there would be a button where they can click, and if they have an active CE broker account and they're using that, it would show whether or not CE broker reflects the number of hours of documentation sufficient for them to renew their license. It will still allow them through that process either way, but it's a way that people can verify as a check when they're going through that, okay, I've uploaded my documentation, I'm renewing my license, I'm affirming to the board that I completed all my hours, and then CE broker looks good too. So if I'm audited, it should be very quick. We haven't quite got that connection built yet. It might have to go into the new licensing system we're moving towards, but that is something that's still on our table. Concerning some other items under legislative updates, this interim, there is a House Legislative Committee called the House Select Committee on Government Oversight, and I wanted to make you aware of one of their recent meetings. They met on July 29th, 2025. The primary focus of that meeting was reviewing some of the operations of the Board of Nursing. Although there was some information that they included in that meeting that was from the BSRB, they had done a legislative request for some information from state licensing boards in terms of what processes do we follow when we renew someone's license, what do we send out if someone's license is getting close to expiration, some of those types of things, what the process if someone needs to reinstate their license. And so we provided some basic information, and some of that was included in a document that was passed out in the committee. But we were praised by one of the people who was testifying during the committee meeting. There were some issues identified with some of the practices by the Board of Nursing in that meeting, but one of the speakers at the podium did say that they are also licensed as an addiction counselor, and they praised the BSRB because we send out emails 90 days out, 60 days out, and then 30 days out if someone's license is about to expire. And then if someone's license does expire, that's not a violation. You're allowed to have your license expire. The issue really is you shouldn't be practicing unless you have a valid current license. So if your license does expire, we send out a message to those individuals too that just says your license is now expired. If you do wish to practice in the future, you will need to reinstate your license. So please don't practice any longer. So we do provide that service as well. And so in case you were curious about that meeting did take place, but the primary focus was on a different agency I just thought it was relevant because of the connection of licensing boards. And, we are mindful of some of the conversations that are taking place. And if we can use some of that information to make additional improvements in our processes, we want to do that too. So, turning next to some updates from the most recent board meeting. Our board met on July 28th, 2025. There were a number of advisory committees that had opened up the process to consider new applicants for the advisory committees. And so there were 9 new advisory committee members who were appointed between most of the advisory committees. Only Marriage and Family Therapy has yet to make recommendations on new members, but I expect they will do that this month in their meeting. And Behavior Analyst, they had a discussion where they had come to a conclusion on 1 new person, and I expect they will probably recommend 1 additional person. So that'll probably take place at their August meeting as well. The board did have a discussion about the requirement of background checks for licensure. So currently right now, the BSRB does not require background checks for licensure. There was a statute that was passed a few years back that provided the board authority to do that if the board were to choose to make that a requirement. And since that point, the BSRB of the state of Kansas actually has passed 3 different laws that have added BSRB licensees to multi-state compacts. The first was the SIPAC compact for licensed psychologists. The second was the professional counseling compact. And then the most recent one was the social work multi-state compact. I think the social work one passed in 2024, professional counseling in 2023, and then SIPAC, I think, in 2021. SIPAC is fully functional, and the language they had on background checks was that states need to have a requirement of background checks, but they have 10 years to make that a requirement to come into compliance with the compact. For professional counseling, there was also a requirement about background checks, and they took a different approach. Their rules committee basically said for someone to practice under this compact, they would need to have undergone a background check at the condition of licensure. And so for the states that didn't require that, that is something they will have to do before their licensees are eligible. And then for the social work multi-state compact, essentially it again required background checks for anyone wishing to practice under that multi-state model for the compact. And so at the board meeting, I did bring it to the attention of the board. I also identified the states that surround us that from what I can tell from my research, most, if not all of those states require a background check as a condition of licensure. I've done some research in talking to representatives of the KBI. The cost of a background check is about $57, and the cost would go directly to the KBI. So if they were to implement it here in Kansas for BSRB licensees, there would be no actual money that the board would receive for our operations. It would essentially be a pass-through, collecting that money and providing it to the KBI for the background checks being run. And so I did bring it to the board with all that information about the multi-state, about the comparisons between different states. And also when the social work compact was going through, the legislative sentiment that I heard was it appeared the legislature was in favor of background checks being a requirement. And personally, I do believe it goes towards the public protection mission of the board. And so I encourage the board to make it a requirement for licensure, at least for original licensure. If someone was wanting to reinstate a license after it had been expired, or someone had a suspension or license revocation. So original licensure, reinstating the license, and then also a much smaller group, but for our student temporary addiction counselors, that's really not an application for a permanent path to licensure, but we want to make sure that people who are providing services, we have done our due diligence. And so for that group of applicants, they would also need a background check. So as part of the original application process for licensure, and then reinstatement, and then for that group. And so the board was supportive of making that a requirement for licensure. And so since the board meeting, I met again with KBI. I'm working through the logistics and the details. We are also wanting to provide an opt-in method for individuals who are already licensed. If they would like to go ahead and get a background check, that way that would make them eligible for the compact. And so that is something that's a little more challenging, but other states are wrestling with this too. I believe Georgia, if not Florida, and I think Louisiana was also a state that passed the compact when they didn't have a background check required. And so we're working with the director of the compact and trying to see how we can implement this and make it so that when that compact is ready to become functional, we can be close for our licensees to be eligible for it as well. So the background check was something the board supported. the question now is how we can move forward on making that go live. And so we'll have more details as we get more information about that. And then just the last thing I'll share from my report from the board meeting, one of the major tasks the board members are working on this fall is going through a giant grid of all the unprofessional conduct regulations for the 7 professions regulated by the board. So this advisory committee and others spend a lot of time going through your unprofessional conduct regulations, making recommended changes and recommendations to the board for changes. And now what the board is doing is taking all that information, and we've created a grid where we see each of the different topics and then side-by-side language as much as we can. Some of the regulations are worded a bit differently, but as much as we can, we lined up similar topics or the same topics, and the board is trying to see, can there be uniformity across language? So they're going item by item with a goal, but by the end of this fall, we can submit those through the process to have the unprofessional conduct regulations revised. So been a lot of work that's been going on between the BSRB operations and the different work the board is doing as well. But I'll go ahead and end my report here and see if there's any questions on anything I talked about or any other topics as well.
Thank you, David. Any questions for David Fye? I can say from a board member perspective, going through the statute or the unprofessional conduct regulations has been extremely helpful. It's elicited so many good conversations between the different disciplines, and it's been really valuable. I look forward to it every time we tackle it because we really get in there, and I have said many times we're so lucky to have David Fye for many reasons, but one of them is his legal background. He knows how to get in there and really sift out what's going to be a problem, where are the inconsistencies, and we have really benefited from that, especially with our unprofessional conduct regulation process. It's just been really great. But thank you for shepherding that, by the way. Any other questions or any questions for David Fye? Okay, we will move on to professional counseling compact update. That's very exciting. David, do you want to talk about it first?
Sure. So we have heard from the director, Greg Zierls. He's the executive director for the Compact Commission. And Laura is our Compact Commissioner here for Kansas. And so Laura and I have been talking with Greg and wanting to see how Kansas can come under compliance with the compact so that we can be ready when the compact goes live. The goal is still for the compact to go live sometime later this fall. There is a data system that is currently being tested, and so that is one of the major lists that the Compact Commission is working on. They have some data from some other states that they're running through the system. They want to make sure that when they go live, they won't have any issues. And so this will also be a way that people can verify if someone is licensed in a different state, do they have a privilege to practice in another state? And so that progress is going well from what I hear. And I know that there was some question about fees for the privilege in different states. And Laura, did you want to talk about that, or you want me to share information on that topic?
Sure, just we've had some requests to understand what the fees are, and there's a rubric that Greg sent out that was unfortunately confidential, so we couldn't share the details of it, but we can say that our fee is going to be $30 to join our state. And those fees range from, are there any zeros, David? I don't remember. There was a $5.
There's at least one zero, and it might be Florida, I think, but most of them were right around 25, if not more. So.
And a few were 200. I mean, there is a range. We are definitely on the more affordable side, which I like. Other fees, I mean, yeah, we'll be, there will be other fees associated. There's a fee that you pay to the Compact Commission for them to process all of this. There will be this background check fee. There will be some other fees, but our fee is very competitive. And we hope that as a result that we attract a lot of people, of course, practicing in our state. Anything else you want to add about fees?
I think, but just to kind of clarify, the fee the Compact Commission will be charging as their administrative fee will be $30. The Kansas fee will be $25.
25, right.
Yeah.
I'm sorry, I had 30 in my brain.
That's okay. It's $30 for the administrative fee that the Compact Commission will collect for their operation. And then 25 will be the Kansas fee. So if someone is licensed in another state and they are wanting to practice in Kansas, the fee for our for out-of-state people will be the $25.
There was at the Counseling Regulatory Board Summit that David and I were at in Austin last month. They did a mock-up, a trial, and everybody got a username and a password. We got to go on and see what it was like, and it was very easy. It was very easy to register. It was very easy. There was a scroll down menu that showed all the states and some, mocked up fees and mocked up processes and so forth. And it was very, very easy to join. So when we go live, which they don't have a specific date, but they've been very excited to say they're pretty confident that we'll go live in the fall. Of course, there are going to be people with a lot of questions but I think it's pretty simple. I don't think it'll be too difficult for people to register. Very excited about that.
And just to kind of gauge expectations, what they've told us is as soon as they have multiple states that are all in compliance and ready to go live with their data and everything else, they will start it with those states and then add additional states as their states, meet all the requirements. So a number of states are struggling with the same background check item that we are working on. There were also some states that had a requirement of 48 hours in terms of their education for professional counseling degree. Under the compact, the language on that is that you have to have a degree with 60 hours. And so there's a way that states are verifying if somebody has a 60-hour degree versus a 48-hour degree. So there's a few things like that. But the background check for us is the major thing that we're working on right now. And so, but there may be possible that some states go live. And if we have not resolved this issue, we may not be one of the initial states. We hope to be. But the background check is a really important thing. We want to make sure we get it right. We do expect that it will change some of our operations here in the BSRB office. We are wanting to collect information that is helpful in terms of public protection. However, we know that we will likely find some things that will need to be investigated, so that will change the workloads for our investigative staff. It'll be some training that'll be required for our licensing staff to make sure that we are understanding how to review the information and then keep confidential the information that we do obtain from this process. So it will be another step forward, but we're really excited about it. And if we can get this issue resolved with the background checks, I think we should be close to being eligible for the compact. So we will be reaching out to licensees once we have a process figured out for people to opt into that. So that'll be sometime later this fall.
We also will have FAQs that'll be available on the BSRB website. So hopefully, as we have more answers to more questions, we'll publish those and people can really get ready. And one thing I'll add about the survey that David has conducted. How many surveys have you done, David? For how many disciplines? Did you do 5 or 6?
So we did surveys for all 7 professions.
7.
And
okay.
there was a different set of questions for each group of licensees. So I think probably that's somewhere around, 14 or so different versions of the survey that went out through SurveyMonkey. So
the reason I brought that up at this point is because the timing of the survey is very important. He is going to have data pre-compact and post-compact about licensees, their motivations. We'll really be able to measure well, how the compact is affecting our state. I mean, we had that data anyway, as far as numbers of licensees and so forth, but it's really good timing, the survey.
yeah, and one of the measurements to really find out, how effective will this compact be for professional counseling is we currently don't know if this is going to be something where people allow their license, everyone needs to have a home state license. But for people who, let's say you're currently licensed in Kansas and you live in Kansas and you have a license in Missouri as well, are people going to say, I'm going to drop my Missouri license and do a privilege? Or will it be something where they say, I'm going to drop my Missouri license, but now for the same amount of money, I can get a privilege in Missouri and in Nebraska and in Colorado and in Oklahoma or something like that. And if they do that, then perhaps it would be a way to have more access to provide telehealth services into those different states. It'd be a better way for people to have continuity of care when they do have clients that go to school in a different state or go on vacation. And so I think that is the real goal of the compact. It is knowing that states will lose some out-of-state licensee funding, but if the balance works where more people are obtaining privileges and the fees are lower for that, I think it provides better continuity of care and better mobility of practitioners and different things like that. So we don't have the data yet. That is the hope, and we're just going to have to move forward. And there are a couple states that have basically had concerns about losing the out-of-state license revenue, and so their privilege fees are almost exactly the same as a license fee. And I understand why they would do that. I just think if we all get on board with lower fees for out-of-state licensees, the privileges, I think it'll all work in a productive way. But we won't know really all the details until we look back, probably in a couple of years. So
For sure. It's a very exciting time about all this. Okay, any questions about the compact or anything David has said or I've said? Okay, we will certainly keep you updated about the compact as it develops. You will be hearing about it. Okay, let's go ahead then and move on to our next item, which is old business. The first one is reviewing and discussion of the survey of licensees. So David, you want to go ahead and take that one?
sure. And for those of you that are new, if this is a new topic for you, let me go ahead and frame it just a little bit. We talked a little bit about last year, the advisory committee worked on survey questions for licensees. This was inspired by some surveys we've done of social workers in the past. The board has surveyed social workers at times to collect information about issues out in the field, or also some workforce related data as well. And so there was a survey of social workers in 2021, I believe, and then also one in 2024. But basically, based on those surveys, we thought this might be helpful to offer to the other professions as a way to collect some helpful information and ask some different questions and really try to become a part of the solution when the legislature and others are really pushing on needing more practitioners in the workforce. But how can we understand sort of how people are operating, the shift between in-person services versus telehealth, expected retirement sometimes in the next few years, and also what issues people are seeing out in the field, and how can we sort of put a spotlight on some of these topics and then collect information, and then what can the board work on in response to this information, but then also how do we use this information to share it with others and then build partnerships with different groups that perhaps if we can't find a solution to this, maybe others can, and we can just start that as conversations. So each of the advisory committees had a discussion about possible survey questions. As much as possible, we wanted to have some level of uniformity while also realizing that some questions were going to be specific for certain professions. But if we could have some questions be uniform, we could have a comparative report across all professions once we'd collected all the data. So we did just finish the last group of surveys, and that was to social workers. And so we're working on the comparison report. But what we have as well is an individual survey report with all the data for each of the professions. And so you had a draft report that you received. Each of the other professions has received a draft report, except for social workers, just quite yet. But we tried to organize this in a way that would be helpful for you to work through. This is a lot of good information, but the report is also about 113 pages, which is a big lift to ask you to review all this information. So one thing we tried to do with some intentionality was we tried to provide a summary of the information towards the front. So the first 15, 20 pages, that really goes through each of the questions. And then for the ones that were multiple choice, we provided charts to display the information. For those that had open field responses, members of my staff, primarily Emma, my assistant, and Tyla, one of our licensing specialists, reviewed a lot of that information and tried to summarize it there. And then we did want to preserve the voices of the people who had provided so much good information. And so we decided to attach as appendices all the open field responses while making some minor edits to preserve confidentiality. And so what you have in front of you is that full report. And we provided a walkthrough to the advisory committee a couple meetings ago. And at the last meeting, we asked for some initial feedback. At that meeting, we said we wanted to essentially separate this into more digestible segments so we can have good conversations at advisory committee meetings. So we said for this meeting, focus on two different topics. The first would be, pages 14 through 15, which ask both levels of license. Are there any practice-related negative issues that you have experienced or seen out in the field, or areas where people needed more education or training in certain areas? And then the second item we wanted to focus on for this meeting was page 18, and also the appendice in the back for pages 70 through 79, which focused on the category of supervision. For LPCs, have you experienced any issues essentially receiving supervision? And for LCPCs, have you experienced any issues? And we tried to limit this to the last 2 years because we realized there have been quite a few changes in supervision, especially with the shift from in-person supervision to allowing all supervision now by televideo if people want to go that route. And so we asked if there were recent things with that. So I'll open it up for discussion, and I can try to help guide some of the conversation. But if you have had the opportunity to review the pages for both of those sections, I just kind of want to hear your feedback and your thoughts. And if there's kind of a lull, I'll jump in, but I prefer for some of you to kind of lead this part of it. So we'll start first with the first topic we talked about, which is in the past 2 years, have you seen any practice-related negative issues or times where people appear to need more education or training? I'm paraphrasing that question, but any comments from you as you read through the summary information or as you read through the individual responses in the back of the survey report? And feel free to go ahead and unmute yourself and just share your thoughts.
David, one area that I see that might be an important focus is confidentiality in electronics. Here at our agency, one of the things that if we have a problem with confidentiality, a lot of times it comes through emails where people are sharing information about clients. They're not paying attention to who all's on that email chain. And it's not something that I think practitioners do purposely. It's just we become so comfortable with electronics that sometimes we can share information maybe we shouldn't. So that's just one area that I see that comes up.
Okay. Thank you for sharing this comment. Anyone else have comments about this topic and something that maybe stood out as you looked through the responses from the LPC category of respondents or those from the LCPC?
I'll say two things.
Right.
One was the comments about supervision, the need for better supervision and training. We have a subcommittee that we're forming about supervision and to address some of the concerns in the survey. And the other one was talking about frustration with knowing about state laws and the continuity of care across state lines. And I'm very excited to say that we have an answer for that. So the compact is going to make that so much better. Excuse me. Any questions for David Fye?
One thing I'll highlight too, as I was looking through the responses, we wanted to provide as much of the open field answers as possible, but also didn't want the report to be 200 pages. So if people gave the same response, we tried to consolidate those. So I do find it helpful when we look to see, okay, how many people responded to the survey question, and then how many people said no. And so, you know, there are a lot of issues that were identified, and some of these we may be able to assist with, and some we may not. But for the first one, the LPCs, I think 212 individuals answered that question, and 71 of them basically they had full range to say, you know, are there any issues that you see in you know, people need more training or education in different areas, and 71 said no. And so I do feel like there is a positive element to that. And sometimes people said no with some additional detail, and we didn't group those all together. So the answer, the number of people that probably said they did not see a lot of issues, it is significant, and that is a good sign. And we don't want to overstress, you know, one thing or another. But I do feel like there was some just really interesting comments from certain people. One thing that I saw under both the supervision topic, which we're going to talk about here in a little bit, and under this, it seems to be that there are certain things that cost factor was referenced in terms of the cost of supervision or the cost of continuing education. One thing, you know, when Laura was talking about, you know, how can we be helpful and what things can we work on? We talked a little bit at the last meeting, and we talked a little bit in the fall about wanting to develop an alternative jurisprudence type tool for licensees. And we decided to propose to the board a way to do this where we would offer it for continuing education credit for free. And so this is at least going to help with some of those cost considerations. That was not our primary motivation. It was really to make sure that people were more knowledgeable about some of the rules and the laws. But you know, two birds, one stone, I suppose. And so if we can get to the right outcome, that's great for that way too. But any other comments that you saw as you looked through? Did any of you notice a lot of different responses when you were looking at the responses from the LPCs versus the LCPCs? Did anything stand out to you where it seemed like the clinical level of practitioners were talking about one topic a lot more than maybe the LPCs were talking about?
The LCPCs mentioned something about managing too many supervisees, the stress of that. I remember reading that, and that wouldn't be an LPC issue. That's the only one that comes to mind.
Okay. I don't want to cut this conversation short, but maybe we can move to the supervision question and kind of talk about that item as well. So we had asked the advisory committee members to also look at the section concerning supervision. One of the things that I thought was helpful about, I'll go ahead and share my comments first on the supervision topic, and then feel free to jump in with any takeaways you had after reviewing the summary information or any of the information in the appendices. But for the LPCs for supervision, there were about 227 that responded to that question. And the question asked, you know, in the past 2 years, have you experienced any issues with supervision? And 151 said no. And so that's, you know, over half of the LPCs responded that they have not had a negative experience with supervision, or at least not so much that they would comment on it specifically, which I thought was actually pretty good. You know, there were other items that were noted, and definitely want to be mindful of looking at those, but I don't want to overlook what I would consider to be a positive response in terms of people. And there were other that were stated as positive responses. So I think if you group the ones that said no with the ones who spoke positively in other ways, I think that's helpful information as well. Some of the items, though, that I did see individuals highlight concerns about was the cost of receiving supervision. And you know, in Kansas, there is not a statute. We do get asked about this from time to time. Is there a statute that governs how much people can charge for supervision? And there is not. I think I have asked some other colleagues in other states, do you have something like this? And most states do not. most states just take a hands-off approach and let that be negotiated between the people receiving supervision and those that are providing it. Some people mentioned it was hard to find supervisors, and we have heard this concern a few times. We do have a list of all of the board-approved supervisors that people can request from the BSRB office. Additionally, we had heard that potentially the list may not be very helpful because some people on the list are no longer providing supervision or maybe have no current openings. And so a little bit ago, Leslie Allen, the Assistant Director and Licensing Manager for the board, actually sent a message out to everyone who was on that list. I think there were over 200 people who were listed as board-approved supervisors. And she asked them, are you currently still accepting people to provide supervision to? And over 100 people responded back that they are still open to receiving people to provide supervision to. And so we have the full list, but now we also have a way that we can point to a group of 100 people that have self-identified as still being able to take people in terms of supervision. But there were also some comments that I saw from people who said, I can't find a supervisor who's physically close in proximity. And I think that does come down to preference, whether they want to have in-person supervision or telehealth. I think one of the changes the board made recently to allow all supervision by telehealth was to open it up. So you didn't have to have someone who was geographically close. But I can certainly understand people wanting to have in-person supervision compared to telesupervision, although it seems like a lot of people who responded really appreciate the flexibility and like, telesupervision. And then the other comment I saw was there were a handful of people who said the restriction that the supervision must be provided by someone who is a professional counselor is challenging for them. I think there were a couple people who said, there's someone at my work site, I'd like them to provide supervision, but they're not a clinical professional counselor. And so they were questioning, is that requirement, does it need to remain in place, or can there be more flexibility in who can provide supervision? Other people said, there may be people from other professions that they would want to work with. And so they questioned the current requirement. And so just those are some of the things that stood out to me as I looked through for the LPCs. Any of you have any comments or feedback as you look through some of the concerns with supervision for the LPC respondents? And then we'll talk about the LCPCs after that.
So David, can we back up just a little bit? And when it comes to providing supervision remotely using televideo, currently, is there any regulation that outlines the number of in-person sessions you have to have? Or is that just between the supervisor and the supervisee?
So in terms of your supervision, you can do all of your supervision remotely. So there is not a requirement that says every fourth one needs to be in person, or 25% need to be in person. Now it can be all supervision remotely.
So did any, and I was kind of reading through, but was there any indication of whether the supervisee felt it was more productive in person versus remotely, or was it the same?
So, and I don't necessarily want to say for sure it's these set of responses, because I may be a little bit skewed in terms of what I remember, because I've read similar responses across about 6 professions at the moment.
Right.
So I can't say for sure this was in professional counseling. I can just kind of speak broadly across the profession. There were some people who said they had a preference of in-person counseling or supervision, and they felt like it was better for them. Or maybe some people said they thought they got more out of it in person. But there was still a question of, if it is better, is it still necessary to be done in person? And I think that was sort of the question to kind of ponder. For some people, they may do better getting in-person supervision. Some people may be as good remotely, or maybe better remotely. But is there enough of a benefit to in-person supervision that it needs to be required, at least on some level? And I think at least right now, it seems like the majority of people would prefer that there is the option at least to do it all remotely.
Okay. Well, the reason I asked that question is when it comes down to them stating that it's hard to find a supervisor, I would think that if you can do it all remotely, that should make it fairly easy to find somebody within your license. So I'm not sure if they're taking that into account or not. The other thing in the survey that jumped out to me, and I don't know if other people are seeing this, but this is coming up more and more for us, is the ethical implications of artificial intelligence and using that for notes and that type of stuff. I didn't see a lot of feedback on that. Are you hearing from other licensures any concerns with that?
Concerning artificial intelligence, yeah, and this may be something that we could focus on for the next meeting because there is a question specifically for artificial intelligence. But we did ask, are you currently using it in your practice? And then a number of licensees just across the profession actually identified certain tools that they're using or what they're using it for, whether that's to take minutes or notes or to do some sort of analysis. With them, it seems like they're using it as sort of a grammar type tool as well, to make sure they have a little bit more professional language in some of their writings and things. So I think there's a few different uses that people are using with artificial intelligence, but yeah, I would say that might be a good topic for next meeting, that we kind of focus on that question and then kind of look on the responses for it.
Okay. I would appreciate that because
Okay.
it's getting to be an issue for me anyway.
Michael, I just say that over the last the end of my career, many physicians started using templating notes. The difference between a templating note and an AI note doesn't appear to be that dissimilar, other than as a practitioner, you generally write the template and fill in the blanks where there are blanks needed. From an AI note, what I'm seeing so far in the legal discourse is that whatever that note says, you're responsible for. You can't, and just like the templated note was, if you're going to use an AI to help generate the note, you're still responsible for as the author and the signer and whatever goes out on that note. So it does not relieve you of being responsible for the content of the note. And I think there's a lot of things that AI will help with. Jury's still out. Legal cases are few, which I follow this, as the board knows, I follow this with a lot of energy because I find it to be the most interesting thing that's going to come about in the next 3 to 5 years.
Yeah. And Jim, I agree. One of the things I run into quite a bit is staff. We have a few hundred staff, and so from time to time, they'll come up to me and say, can I use this particular software or this AI software? And I'm kind of in the situation where I have just enough information to be dangerous. And my concern is I don't know the HIPAA regulations or the confidentiality, that type of stuff that plays into all the different AIs that are out there. And we're not really to a point where there's any standardized AI software that I know of. And so I think the more information I can gain, the better I can gauge it. I know it's not going away. I know that. It's just growing.
Yeah, the other side of that, I'm using AI and HIPAA as two different sides of a coin. In other words, the HIPAA part of it is clearly the government's not going to tell us until someone in a black robe does.
Right.
Of what the HIPAA violation is. But when you put something into any software package, you are responsible for any of that patient-related data that can be identifiable to a patient. So the tracking security, if you would, is critical.
Yeah, that's a big one.
We have in the future, we have a person who worked at Cerner and she does consulting about AI worldwide. And she will be available at some point in the near future to speak about some of the trends, some of the ways that folks are thinking about it globally. So as soon as we can get her in here, she was supposed to come actually to this meeting, but then she had to travel. But she is available and we keep framing this. These are the things that we need to get our head around, so that we can, move it up the food chain to statutes and regs eventually, but we need to get our head around it. It's big. I mean, it's big.
I had a couple quick points. One to piggyback off of you, Michael, because you mentioned a good point that, if people knew or, it should be pretty easy if you can do supervision remotely to find somebody. I've had many supervisees reach out to me not recognizing that they can do all remote. And coming straight out of school, and especially if you're newly licensed, you don't know all the statutes and regulations, especially this hasn't been around too long when you think about it. So just wondering if it's a matter of educating more when you send out that list, or even just as in the field, letting them know you can do it all remotely. Because as soon as I tell them, like, even though I'm in Topeka and you're in Wichita, we can still work together. And then they have no problem with it. I know some people have a preference, but some it's just a matter of education.
Yeah.
That we need to put that out there a little more. And the second thing, somebody pointed out to me this week, and I don't know what we can do with this. I have a colleague from Texas, and she asked me, how come none of us are putting the -S after our name? And I'm like, that's not a thing here in Kansas. We don't do the LCPC-S for supervision designation like they do in some other states. And that surprised her. She thought that was a thing everywhere. And she said, but that would help people find supervisors. They would just see your credentials and know that you're a board approved supervisor. And I was like, gosh, how would that help people know I'm a board approved supervisor? Or do I need to even just put that in my, I tell people, yeah, I maybe need to put that in my email line, board approved supervisor, because I don't have that anywhere. So
yeah. Yeah, I always include, after all my letters, I usually put BAS on mine.
Is that a thing? Did you create that, Michael? I'm going to add that.
Well, I don't even know if they still do it. David could tell us, but I went through the training to get the board approved supervisor thing, and so they sent me the little letter and all that type of stuff. And so yeah, I use BAS on mine, and I think that's perfectly fine as long as you went through the training. But do they currently still have that training, David, Laura?
Yes, the training exists. Yeah.
Okay. And I will tell you, I've said this before. When they came out with that training, I went into it with a little bit of negativity, but I actually enjoyed it quite a bit. I learned a lot from it. So if anybody wants to do that, I would say go for it. It is a good training.
That's good feedback.
I mean, there's a lot of board approved supervisors. We don't mention that because we don't have that designation like some states. So maybe somehow encouraging, like, put that somewhere in your title. Because I think a lot of people just don't know who is and who's not.
It will certainly be easier to add it to your title saying board approved supervisor than to get, we don't have an approval for a -S, but we can look into that.
Mm-hmm.
Is there any, and I guess I should ask since I'm on here, is there any reason that we can't put BAS on there? I have ever since I took that class, so.
So there are certain sections of the statute that talk about, not to use certain initials unless, you hold that level of license. I'm not familiar with any kind of language about that for board approved supervisors. I know that there has been discussion in the past as far as like a -S, and that there has not been enough support to kind of pursue that as far as an addition to like the statutes or regulations. So -S wouldn't be something that would probably be allowed, just because it's not something that we would attach to our licenses. But the using of the phrasing board approved supervisors, I don't think there would be any issue with that. But I'll double check and go through the statutes and regulations just to make sure. I don't want to guide anybody incorrectly on that one. I just don't think it has not come up recently. But you're right, that would be a nice way for people to identify supervisors, at least in your address information.
Thank you.
Thank you.
We also plan to do a newsletter in the near future. And I always make a list of the things to add to the newsletter, and those are a couple of them. So thank you for your feedback about supervision, about people not knowing how to find a supervisor, the list. So we'll make sure that when we'll be doing an email here or a newsletter, and we'll put those items in there.
Well, to answer Amanda's question, I think I did make it up. I just didn't know I was making it up. But David will let us know if we can keep making it up.
Well, just to kind of wrap up this section of the survey review, we talked a little bit about the supervision question and about the LPC responses. There was also an opportunity for LCPCs to respond, and 344 were responded to the survey, and 222 said no, they had not experienced issues. It was a little more tricky to kind of read into that 222 answer, because some of the people who responded to the survey who did provide a little more detail said they are not currently supervising and have not in years. So it's possible that they could be saying no, not necessarily because everything is going great, but because they're not involved with supervision, so they really couldn't comment on it. So so that was a little bit different. But some of the takeaways that I saw, cost again, maybe some bad pairings between supervisor and supervisee. Felt like there were a few of them that either said they had a bad experience or they had to work with multiple supervisors because of an issue. Some talked about supervisees just going through the motions, maybe not getting the full impact of supervision. And then maybe lack of available trainings. People did express that a bit. And licensees maybe not understanding what is required to practice independently. And so we did kind of hear on some of the other professions, some people were saying, we would like less requirements for licensure, maybe a general deregulation tone. But then other people responded to the survey and said, I'm concerned because I see people out in the field and I wonder if they are properly educated and trained to be practicing independently. So I have concerns about, where they're at, even though they're able to start practicing independently. So we kind of have the push and the pull on that topic. And so just maybe for the next meeting, we can kind of follow a similar approach, but for some of you that are new, to make sure that we have good dialogue on this topic, we talked a little bit about a process where we would take a couple questions and focus on them for discussion at future meetings until we've gone through the report. And so for the next meeting, how about if we really get into that topic, the question on artificial intelligence? I think that was, let's see, maybe question Question 15, do you currently use artificial intelligence in your practice? And if you do, in what areas do you use AI? So as preparation for the next advisory committee meeting, maybe say, look at question 15 for the LPCs, which is question 16 for the LPPCs, and then read the summary information there, and then also read through the open field answers and be ready to discuss any takeaways from that. And then how about for the other question to focus on for the next meeting, how about looking at question 13 for both set of licensees? Question 13 focuses on telehealth and says, over the past 2 years, have you experienced any issues concerning telehealth, either through professional practice or observations of other practitioners? So review the summary information from the report and then go to the appendices and read that information too. And then at the next meeting, we can do this again, but focus on those two questions, and then you can share any takeaways or anything else as far as your thoughts on those two areas, telehealth and artificial intelligence. Does that sound good?
That sounds great. Thank you for that.
And Laura, one thing I mentioned at the board meeting that I didn't mention in this one is we are going through the process of updating a lot of our technology here. And I'm in kind of an odd situation with updating some of my technology. Still have a few modifications that they're making with my computer. So I did get a notification there might be pushing through an update
no.
for my computer.
Can they
So,
do this at midnight in the future?
yeah, I would prefer that.
Isn't that deja vu? Didn't we do this? Didn't we live this Friday at the last meeting?
Yes.
We did.
Okay,
They said that they're going to try to push it at around 11:42.
Oh.
So
there you go.
if I drop off before the end of the meeting will continue. It'll still stay on the broadcast. I'll just rejoin the meeting as soon as I'm able to do that. So
Yeah, we'll go on without him. That when he got booted off at the board meeting, it was perfect timing because we were taking a break. But my gosh, they really should be doing this at midnight.
I totally agree.
Can't believe you got another email, another notice. Okay, so we have our charge for the next meeting, what we need to study from the survey. Shall we move on to new business? Oh, wait, artificial intelligence. No, that's continued discussion of REG for artificial intelligence. That's really related to what we were just doing. Should we go ahead and continue that, or do we want to wait until after we have our discussion from the survey next time?
Yeah, we can just kind of keep that on the agenda, and then maybe when we look at that question next time, we'll have some more discussion on that. And as you mentioned, there's a presenter that may be able to come and talk to us at a future meeting. So if we have that lined up, maybe we can talk about that as well. So
Okay, yeah, that feels like the right thing to do. Okay, new business, discussion of supervision manual for professional counseling. So I'll take the beginning of that. We are going to create a supervision manual for professional counseling, and we really want to go through and not only do that, but make sure that the statutes and regs are pretty solid for what we're asking of our supervisors, for our counselors in the state. So we have formed a subcommittee. That subcommittee was approved by the board at the last board meeting, and that was, I made my notes. Let me see. Yeah, he approved all three of us to join, all three of the people who are joining. And do you remember who? No, he said we could set the meeting at any time. I'm sorry, I'm looking for my notes and I should have that, but I don't. Amanda Wade was it Amanda Wade that was added? Amanda Wade, Masha Magsudi, and then Amanda Perez or Vanessa Perez. Are those the three that were added? I'm sorry. I don't know where I put my notes.
and I think it should be in the minutes from the
Yeah.
last meeting. Let me go ahead and pull
I'm
that up.
sorry, you guys. At any rate, we were approved to have a subcommittee. So what we're going to do, we'll start meeting after this board or after this advisory committee meeting. I'll go ahead and call a meeting and we'll start doing our work. And so we're going to look at a supervision manual, look at statutes and regs, and just make sure that supervisors have what they need so that they can move forward in a more comprehensive way. Did you find those names, David? I can't believe I don't have them.
That's okay. So those were in the minutes from the last meeting. It was Amanda Wade, Vanessa Perez, Masha Magsudi, and yourself. That's all.
Right. Okay, so you'll be hearing from me. I'll send out a Doodle Pro later this week, and we'll figure out a time when we can first meet for the first time. And I'll email Masha and tell her that we're going to proceed and to look for that Doodle Pro. And thank you for being willing to be on the subcommittee. We don't form a lot of subcommittees on this advisory committee, but it's really helpful whenever we really kind of need to do a deep dive and really tackle something. So this will be really, dedicated work that we'll do, and it'll be good. So thank you again to the three of you. Masha's not here, but thank you to the three of you for agreeing to be a part of the subcommittee. David, what else do you want to add about that?
No, I think that's good. No other notes for me.
Okay, thank you. Okay, next item of new business, discussion of alternative pathways to licensure. So David, I'm going to have you handle that one.
Okay, and this was something that the chair, the chair of the BSRB board did ask the advisory committees to start taking a look at. He had brought this up at the meeting that took place in May. And basically just said, he would like each of the advisory committees to have a discussion on this point. It doesn't mean that the advisory committees need to necessarily make a recommendation on changes to things, but he would like the advisory committees to have the opportunity to talk about possible alternative pathways to licensure that may not require passage of a national examination. And so I wanted the opportunity to pull some information from what other states require and whether other states have started to have a conversation about this kind of thing too. So I did put out this question on a listserv for professional counseling licensing boards. And I asked them, do you have an alternative pathway for licensure, a current one that does not require passage of a national examination or licensing examination? And I heard back from Louisiana, New Jersey, California, Pennsylvania, Oregon, and Nevada, and they all responded no. They do not have a pathway to licensure that would lack a passage of a licensing examination. So none of the states that I have reviewed so far would allow an alternate pathway for licensure that didn't require passage of an examination. Also, in terms of your profession, passage of an examination is one of the important components of your multi-state compact, which is getting close to being operational. So part of this is looking at what individual states would require, but I think that needs to be part of the conversation too. We would not necessarily want to pursue something that would make people ineligible for a compact. So that is something to consider in this too. One thing that we have talked about as an advisory committee, and we've had speakers come and talk to the committee about, is you need to require passage of both two different examinations. And some states do require passage of the exam, the NCE, some require passage of the clinical exam, some require passage of both. In Kansas, we're a little unique in that we have two levels of permanent licensure. So a lot of other states would only have a temporary or a provisional level, and they sometimes try to compare our LPC to that, except people can remain at the LPC level for their entire career and provide services. And some of the other states, they have a certain number of years you can stay at that level, but you have to reach the clinical level by a certain point. Otherwise, you have to stop providing services. So I think, at least in our model, one of the reasons why we did have two different tests is because there's two different levels of licensure that you could stay at your entire career. So that's a little unique. I think Kansas and Ohio have that as their setup. But I have heard that maybe Utah has looked at alternative pathways to licensure. And so I want to do a little bit more research, but I wanted to present this to you today, that at least from what I have seen so far, no other state have an alternative pathway for licensure that would not require passage of the exam, but I'll continue to look. But I thought I'd open it up, and maybe if you have comments here, I'll go ahead and try to push that update through right now and rejoin you in a few minutes. So if that is okay, go ahead and talk about this topic, and then I will join you here in a couple minutes if that is okay with all of you.
Okay, good luck with that. See you on the other side. So, yeah, this is, I'm very interested in what all of you hear out in the world about alternate pathways. I wonder also, do our educators, have they heard anything from other states or other programs that, I guess it would really be related to other states about alternative pathways to licensure? Anybody have any questions or feedback about what they've heard? I know I heard David say that, the states that responded said they don't have a pathway. That doesn't mean that there aren't people out or states out there that don't have it, but I'm not surprised. I'm not surprised. Any feedback or questions?
I've never heard of an alternative pathway. When it comes to licensure, when it came to the LCPC licensure exam, I actually liked that one. It was something that was applicable. I understood why I was taking it. The one for, and this has been a long time ago, but when I got my LPC, I did fine on the exam, but I didn't really feel like it was all that useful in testing me for my ability. So I don't know, at some point I wish they could kind of adjust exams so that they show your ability to practice, but
Yeah, there's been some talk for the NCE to do more of that, but they they always, the thing that they say is, people coming straight out of school don't have that much clinical experience. And so that's why they tilt toward the emphasis being more on what you've been taught, not what you've experienced. But I agree with that. The NCMHE, is that what it's called? I can't remember off the top of my head. It's definitely more clinical and more about application. For sure. Anybody hear of any alternate pathways to licensing anywhere in any other states that you might be in touch with? I know David will come back with research about Utah, and I'll ask him when I'm meeting with him tomorrow about a bunch of things, and I'll ask him about if there are any other states that he's heard from that might have some options. Texas was talking about something. I don't think it ever developed, but they were talking about an alternate pathway to licensure. So I'll have to go back down that rabbit hole and see.
So if there was an alternate pathway, because what I'm hearing is that there maybe would not be an exam to get that license. What are the limitations on the license? Or is there any limitation? Like, do they have to be under supervision, that type of stuff?
Well, the license, it would still be available to take the test. But you could also, we're looking at, is it possible to also have another way where you don't have to pass the test to develop your pathway to licensure? So I don't know yet. It's brand new. It's a brand new idea.
I just wonder what that'd look like, if it would be like number of hours of work or service, or
Yeah.
how do you replace that?
Yeah, we don't have any, we haven't really gone down that path yet to see, well, what would that look like? It's just something that all the disciplines are being asked to explore. So at our next board meeting, I'm sure, there'll be some, there are some disciplines. I think social work has it. I know drug and alcohol has it. They have some other options for not taking a national test, but we'll learn more about that when we meet as a board. And then see if we adapt it to counselors or not. So this is a topic that we'll definitely come back to you and find out, what we have found out, let you know what we found out, and then we can look at it and decide if this is relevant to counselors. The board really does take our feedback into account greatly, because again, you are the people dealing with the public and students. So our feedback will be held very strongly about this. Any other questions about this? That happens to be our last agenda item, so we can wrap up a few minutes early if we want, if nobody has any questions or any feedback about anything that we've covered.
So if we all leave before David gets back, can we just leave him a Post-it note or something?
Yeah.
Sorry, we're gone.
Leave your screensaver. We all went to Budapest. Bye.
That's what happened when David leaves. We all just follow him.
Right. No, I'll call him and tell him that we ended early.
All right.
Let's go ahead and do that. Our next meeting will be October 2nd, and you'll be hearing from us about the subcommittee, and you'll also be hearing from us about trainings, about the board or the advisory committee training. So look for our emails.
If you need a motion to adjourn, I made it.
Jim, I need a second now. Thank you.
I'll second.
Thank you. Is that Vanessa?
Yes.
Thank you, Vanessa. All opposed, say aye. I didn't think I'd hear any of that. Okay, everyone, thank you so much for your time, and welcome to the new people, and we'll see you in 2 months.
Bye.